So another best strategy for shoulder pain is working the soft tissues around the shoulder. Okay, there's things in your muscles that can result from overuse, from bad posture, from just the cumulative effect of all these things we've talked about in the shoulder pain book. One thing being trigger points. Trigger points are little knots that can form in the muscles. There's actually two real key areas that we tend to work on in our clinic that we'd want to break up when it comes to trigger points. One being in the infraspinatus muscle, which is at the back part of your shoulder blade. It's actually one of your rotator cuff muscles. And when that trigger point is active, it can actually refer pain into the shoulder that looks very similar to rotator cuff tendonitis. We're going to release that with a tennis ball and a pillowcase. Another real problematic muscle is the pec minor and the pec muscle in the front. The more that you stand or sit being hunched forward, the more compressed this area becomes and the stiffer these muscles become. So we can release those muscles even better. Of course, in combination with being much more self-aware of good posture. All this stuff works together hand in hand. Okay? So when it comes down to treating the infraspinatus, so take a tennis ball, drop it into a pillowcase, and then drop it on back, okay, onto that infraspinatus. And you can kind of, move around a little bit. So you can kind of get the tennis ball towards the inside of the shoulder blade, and then work your way towards, actually right over the shoulder blade, and you'll find a knot right back in there that is really, really uncomfortable. Most people have, a spot back there that's uncomfortable anyways, but if it's really active, once I put pressure on it, it could refer pain directly to the front of my shoulder. When we do a trigger point release, we just find that spot, try to find a spot where you can feel, pretty comfortable that you're not putting too much pressure against there. You impart enough force onto it to cause maybe an 8 or a 9 out of 10 pain. This is a pretty uncomfortable process here. You hold it right there, and you maintain that same pressure for anywhere from 30 seconds to 2 minutes. You can take that long for that muscle to actually release. And as it's releasing, don't push harder, just maintain the same pressure. So start at an 8 or 9, and then go down to just a pressure. When you get to a pressure, release, and maybe move to an adjacent spot, and then treat that as well. You can do that maybe 2 or 3 spots in the back there, okay? And then as far as the soft rubber softball here, you can just take and, up against the door frame, and the same idea. You try to find that spot where, there's a trigger point right there, and you maintain that pressure. No rolling, just maintain the pressure. Same idea, anywhere from 30 seconds to 2 minutes, then release it, then maybe go someplace adjacent to it, and then that same idea. All right? And that's trigger point release. Thanks.